Bismillahirrahmanirrahim. I'm Dr. Muhammad Ansari, Assistant Professor of Pediatrics, and in today's video, I am going to discuss digital clubbing, its grades, and the causes of clubbing. First of all, let us define what is clubbing. Clubbing is widening of the distal phalanx of the fingers. It can affect hands as well as it can affect feet, but you need to differentiate it from the natural or inherent beaking of the nails, which is normally seen in many families. That is not clubbing, it is beaking of the nails, parrot beaking or beaking of the nail. Now, there are three defining factors which define or which differentiate normal nails or normal fingers from clubbed fingers. The first is phalangeal depth ratio. Interphalangeal joint diameter should be more than distal phalangeal diameter measured at the angle of the nail fold, at the level of the levy bond angle or at the level of the base of the nail. Interphalangeal diameter should be more than distal phalangeal diameter in a normal finger. If distal phalangeal diameter measured at the level of the base of the nail or levy bond angle is more than the distal interphalangeal diameter, this confirms presence of clubbing. Hyponychial angle is another defining parameter. A, B, C, 3 points are taken, where A is tip of the nail, B is levy bond angle, and C is distal interphalangeal joint. If the line joining all these 3 points is making an angle of less than 180, it is a normal finger. But if line joining all these three is 180 or more than 180, it is consistent with the finding is consistent with digital clubbing. Shamroth sign, the presence of Shamroth window between same digits of two hands, same digits of opposite hand, index finger of right and left, if you join together, it should make a Shamroth window in between. Or if middle finger of right and left hand you join together, it should form a Shamroth window in between. If this window is lost, this is another sign which points towards presence of clubbing. Clubbing is graded into four grades. There are four grades of clubbing, but there is little bit of discrepancy between the presence of these signs. Now, what happens in grade? Normally, the levy bond angle is less than 180 degree, but if this angle is lost, this is grade 1. Only the angle is lost, there is no other sign, then this is grade 1 clubbing. If there is increased curvature of the nail, this is grade 2. If there is increased pulp AP diameter, there is drumstick appearance, this is called grade 3. But for grade 4, there is hypertrophic osteoarthropathy. So there are little differences in grading this degree of clubbing. Grade 1, fluctuation of the nail bed. Grade 2, obliteration of the levy bond angle. To me, obliteration of the levy bond angle is the first grade, and then it is usually consistent with the presence of fluctuation of the nail bed. And then this parrot beak appearance or increase in curvature is grade 3, and then drumstick appearance or hypertrophic osteoarthropathy is the grade 4 of digital clubbing. There are multiple causes of clubbing, and the acronym clubbing is used to remember these causes. C stands for cyanotic heart diseases and cystic fibrosis. L for lung cancer, lung abscesses, lung empyema. U for ulcerative colitis. B for bronchiectasis, which is a suppurative condition of the lung. B is for benign mesothelioma, I for infective endocarditis, idiopathic pulmonary fibrosis, N for neurogenic tumors, and G for gastrointestinal diseases like celiac disease and autoimmune enteritis type of diseases can also present with digital clubbing. So this was my lecture for today. Thank you very much for patient listening.